So this is a case of chronic fistula, post-PEG chronic fistula in a patient with a lot of comorbidities, very difficult to manage. And this is where we found a nice place to use a device that you should know. It's a PADLOCK clip. So the PADLOCK clip is a typical clip that you can easily head on top of your scope. It doesn't need too much. It comes into different size. You see, uploading into the system is very easy. It takes about 1 minute. So this is a huge advantage, especially when you get a fresh perforation. You are under time pressure. You go fast back to the defect to close. And you see it fits a lot of scopes. Now we're using a 𝘃𝗵𝗆𝗀𝗆 single-use scope. And the reason is I want to have the best suction capability possible. You know, the 𝘃𝗵𝗆𝗀 scope is the only scope with a 4.2 millimeter working channel. So we're counting on sucking. Of course, passing through the upper sphincter with the PADLOCK requires a little bit of caution, but once you in the stomach, you still have a very nice field of view. It's not closing too much. It's not creating too much barriers to the visibility or to recognizing the fistula or the target place where to apply PADLOCK. And I was pulling back carefully to look to the chronic fistula. You see, when you have these patients with chronic fistula, there is a chronic leakage, so the skin is a little bit necrotic because of the gastric juice. It's a very difficult situation to manage, especially in patients with different comorbidities. They need to take drugs, they need to be managed, and there is this chronic leak of gastric juice all around, so creating a chronic inflammation. So now we have a transillumination. You can see. I can recognize the fistula. And the PADLOCK comes with his own device to catch the tissue and pull back inside the cap. So this is the time that you need to be stable in front of the fistula. Don't make too many movements. It's very important that you stay as much as possible stationary and use a combination of forces, pulling force with the device, with the forceps, and the aspiration. As I say, they're using a 4.2 working channel, so maximizing the sucking capability. And it takes a little bit of time. You need to wait until you recognize that the fistula is completely sucked in. I see the little hole, and they keep waiting and doing back and forth a little bit. And that's it. So also the way we release the PADLOCK is extremely easy. Doesn't require too much skill. If you are in a difficult situation, if you are with a non-expert nurse, with a non-skilled nurse, you can easily deliver the PADLOCK. And this is, I think, is a very secure, safe solution where you are in trouble.
And I think, as with all these devices where it needs pulling the mucosa into a cap, the harder the mucosa is, the more difficult it is.
This is why I use that scope. Yeah. But in general, this is another solution that we need to keep in our armamentarium to be ready when we are in a difficult situation.